everybody, this is Christine. So I'm going to do skill demonstration on removal of a central line, okay? So first things first is I look at my patient's order and I say, does it make sense for this patient? And let's pretend we have a patient here who maybe they've got sepsis, they got a bad infection, and they're thinking that maybe the central line is the source of infection. Or maybe the patient is done with their outpatient IV therapy, or done with their chemo or what have you. So that's a celebration, yay. But anyways, so it makes sense for my patient to have the central line removed. So I'm going to go ahead and I'm going to gather my supplies that I need, and then I'm going to bring them in with me to the room. So knock, knock, knock. I'm going to wash my hands. Hi, Dan. My name is Christine. I'm going to be your nurse today, okay? He says, okay. So Dan, did doctor talk to you about having your central line removed? He did? Okay, good. So it sounds like you're done with all your outpatient IV therapy, so that's quite a celebration. And he says, yes, and he's excited, so great. Okay, so Dan, before I get started on things, can you just verify for me your name and date of birth? And he says, Dan Brown, and the date of birth matches the wristband, perfect. And then also, Dan, are you allergic to anything? And he says, no. Okay, so couple things, Dan. When we do central line dressing removal, it's a little similar with the dressing change, as far as you're going to wear a mask and I'm going to wear a mask, and that's because I'm going to be removing that dressing, and we don't want any bacteria from our mouths getting on that site. Now, right now I'm already wearing a mask because it's coronavirus, and I got a videographer here, so but otherwise you normally wouldn't walk into the room with the mask on unless times truly change now, and that's going to be the norm for us. So I make sure that I bring in masks with me, and the patient would put one on, and I would wear one as well. If they couldn't tolerate wearing a mask, I'd be sure to educate them that their head needs to be turned away from the side that has a central line, because, again, we don't want bacteria getting into that area. So he says, okay. Another thing, Dan, that's a little different, is I'm going to be placing you in the supine position. So meaning I'm going to have you lay flat while I do the removal of your central line, and then I need you to lay flat for 30 minutes afterwards, okay? And he says, yep. It shouldn't be a problem. I'd probably take him to the bathroom right away and do those kind of things just to make sure that we can stay flat for 30 minutes after I remove it, just to help prevent air emboli. So I go ahead and lower the head of his bed, okay? So let me just get a pair of gloves again, and I'm going to set everything up for myself. So the things that I need to do this is I've got a suture removal tray, because the central line is going to be sutured in, so I need to remove those sutures. I have a culture swab in case I need to culture the area around the insertion site. I have antibiotic ointment and a gauze, so that I can go ahead and place that over the site right when I remove it. And then I've got occlusive tape so that I can tape it on there. And that is going to remain in place for 24 hours, so I need to educate the patient afterwards that he could remove it after 24 hours. And then I've got tape measure to measure the central line once I have it removed. I've got a sterile container in case I need to culture the tip. And then I have sterile gloves. So depending on the policy of where you work, it'll tell you whether or not you need sterile gloves. I love to use sterile gloves no matter what the policy is, because then I've got a nice platform to place this central line once I remove it, because I want to focus on my patient, and that can just sit there until I'm ready to deal with it, okay? So, first things first, like I said, he's laying back. We just can't lay back this guy because he's got fluids on the back. All right. So, Dan, I'm just going to be removing the tape, okay? He says, okay, great. So, again, I'm just loosening the tape on the outside. Place. Make sure you pull it in the same direction as it's inserted in the skin, so you don't accidentally pull it a little bit ahead of time. So now I'm just looking at the site. I'm looking at any kind of redness, drainage, swelling, things like that. This would be where I could open this up, do my culture if I needed to, okay? I'll set that aside. I'm also going to go ahead, take off my gloves, wash my hands, and I'm going to open things up for myself, okay? So I'm going to go ahead and open up my suture removal tray. So for. So open my suture removal tray. I would go ahead and open up my gauze sponge in a sterile fashion, open up my antibiotic ointment, and go ahead and squeeze that on top of there, okay? And I'd let it sit there until I'm ready for it. I've got my specimen container open in case I have to cut the tip off, and then I've got my tape measure for measuring it afterwards. All right, so here is where I'm going to take my sterile gloves. And like I said, some policies state that you have to use them. Some just say clean gloves. But I always use sterile gloves because then I have this nice tray to put them on afterwards. Okay, so now I can go ahead and go into my suture removal kit, and I'm going to go ahead and pull out my tweezers and my scissors. Okay, so I would go ahead and pull up the sutures, cut, pull it out, garbage, pull out the other side, cut the one side, pull it out the rest of the way from the skin, garbage. Okay, I can go ahead and set these aside then, if my fingers would get out of them. And then what I'm going to do is, since these are still sterile, right, I didn't touch anything with them, I would then pick up my gauze that has antibiotic on it from the wrapper, and I would go ahead and place it above that insertion site, okay? Now, Dan, when I remove your catheter here, what I want you to do is either I want you to exhale, or I want you to bear down or perform the Valsalva maneuver. So it's kind of like you're going to be going, okay, like pretend like you're blowing in a straw that the end is blocked. Okay, can you do one of those two things for me? He says, sure. Okay, the reason that we're doing that is, again, to prevent an air embolism, okay? So on the count of 3, are you going to bear down or are you going to exhale? And he says, I'll bear down. Perfect. 1, 2, 3, I make sure he's bearing down. I'm going to go ahead and pull the catheter out, and I'm going to lay it right here. And you notice that when I pulled it out, right after I got it out, I slapped this on here and I'm holding pressure, okay? So I am going to hold pressure for 5 minutes at least on this site, and I'm going to make sure that I'm observant for the next hour for any kind of bleeding, but I am holding pressure for 5 minutes. This is why I like to use the sterile gloves, because then I have a place that I can just put my, my catheter, and it can sit there until I'm ready to deal with it, because my patient is my real focus, right? Right. So after 5 minutes, then I take occlusive tape, and I would go ahead and tape it on the site. And again, that's going to stay on there for 24 hours, and the patient will, you know, you just have to educate them that they can remove it after 24 hours. And like I said, we'll watch that site for the next hour to make sure it's not bleeding too much. So after I've got that occlusive dressing on there, I'm going to come over here and I'm going to take a look at this. Okay, so I'm looking at the end of the catheter. Is it frayed? Is it ragged? Is it jagged? What does it look like? Okay. Actually looks pretty good. But let's say if it didn't, or if I had to culture it, this would be where I would grab my scissors. I would probably take alcohol. I would take alcohol swabs, clean them off, because I'd use these scissors to cut the sutures and I don't want to contaminate them at all. So I would then go ahead, pick this up, and then cut a little bit of the tip off and make sure it goes into that cup. Now I still need to measure, but I like to cut that tip off because I don't want to contaminate it at all, so I like to do that right away, but you could probably measure first and then cut it. Just be careful. Then after I got the tip off and in there, I would go ahead and measure the rest of my line in centimeters, right? So measure that out. Usually you have disposable ones, so. Okay, and then I'd go underneath this side of here and I'd add however long that tip is that's in there. So that's how I usually do it, just so I don't accidentally contaminate that catheter tip that we're sending to see if there's growth on it. So then you could just go ahead and get rid of this. Obviously, if it's ragged, jagged, any kind of issues with integrity of that catheter, you want to let the doctor know right away, because if there's something floating around that patient's body, that's not a good thing. So I've taken care of that. I'm going to make sure that I put the patient's name label on that, as well as if I did a culture, name label on, again, verify the bedside name, date of birth, and that I put my date, or excuse me, my initials, the date, and the time on both of these, double bag them, and then send them down with their orders. Next, what I'm going to do is, again, I'm just going to talk to my patient a little bit more, ask him how he's doing, remind him he needs to lay flat for that 30 minutes. I'm going to go ahead and make sure that he's comfortable laying flat. He has his call light, that his bed is in the lowest position. I'm going to wash my hands, and I'm going to document on my patient. I'm going to document what the insertion site had looked like before I removed the central line. I'm going to document that I removed, 2 sutures, however many sutures I removed, what the catheter tip and the whole catheter looked like when I removed it, the length of the catheter, the total catheter length. If I took any cultures, the cultures that I sent down, I'm going to make sure that I document that I did do the procedure with the patient laying supine, and that when I pulled the catheter out, he performed the Valsalva maneuver for me, and that he remained flat for the 30 minutes, as well as that I educated him that after 24 hours he could remove that dressing. I also would, it's not in your checklist, but it's a great thing to do, and it's just kind of, one of those things that you always do. Anytime you're going to do any kind of procedure or intervention, you take a set of vitals beforehand. I think it's a great thing to do, and also listen to the lungs before you do this procedure, just because, let's say there's a change in condition. God, heaven forbid your patient does have an air embolism. It's nice to know what they were when they started, and then what you have following the procedure, and what's going on with the patient. So that is central line removal.